Dr. Purdy, again, thank you so much for welcoming yourself back here. How are you?
I am awesome. And how are you? I'm so excited to be back.
I'm good. I'm glad to have you back too. So today we are actually going to be talking about BV, the head honcho on social media and TikTok and everything right now. So I definitely want us to just briefly talk about what is BV, bacterial vaginosis, for people who don't know. And then we can just kind of just dive in from there. Does that sound good?
Absolutely. Let's do it.
Awesome. So we can just start with, what is BV? And, from my understanding, it is the number one cause of vaginal symptoms, and it does affect around, I want to say 22 million people a year. So I believe I've had it maybe once, and, a lot of people are dealing with it chronically, and I just want to let you have a second to kind of expound on what it is from, your medical background.
Yep. So let's talk about it. Bacterial vaginosis. If I break down the word, if you notice the word vaginosis. We don't really talk about oosis a lot. We talk about itis a lot.
We do. Right?
And there's a difference in the word. And I think it's an important difference that is worth talking about, because bacterial vaginosis is a condition in which bacteria that already lives there.
Right.
We are, as people with vaginas, we are colonized. And that means these bacteria live in, on, and around us, and they live in the vaginal area. But it's really important that there's a balance. Everything in moderation, including vaginal bacteria. If you can have too much of a good thing. Mm-hmm. And for some of us, people who have vaginas, there can be a condition. I've had it too once. I've had it once where there can be overgrowth of the good bacteria. And it's an oosis, not an itis, where there's almost like a harmful infection. It's more of an annoying infection and less of a harmful infection. Now, is it possible? And I've been asked this question before. Can you get PID, which is an infection of your reproductive organs? Sure. Yes, there are probably instances where people who have compromised immune systems and very, very, very severe infections can get pelvic inflammatory disorder from the otherwise harmless bacterial vaginosis, which is usually Gardnerella vaginalis. There's a few other ones, but that's the main one. You can, but it's exceptionally rare. Okay. Generally speaking, BV is an overgrowth of the good bacteria. It is often the most classical presentation. Painless, gray discharge. I hope you didn't just eat lunch. With a fishy odor. No itching, no pain, no blood, no discomfort is the textbook definition. But in practice and in reality, our patients come to us at Wisp. They say, I feel discomfort. I might have some strange colored discharge, and it hurts me. I'm uncomfortable. And that's actually, and the smell, obviously, but that's actually pretty common. A lot of people with vaginas, I think, are really in tune to their vaginas, and we're very sensitive to changes. And even though the textbook will say, oh, it doesn't hurt, a lot of people say it does.
Yeah. It's some form of irritation or pain or whatever the case is. So I definitely understand that. And then, when it comes to, people struggle so much with trying to differentiate between BV and a yeast infection. And are there true, because since I've had both before, I do know what it's like to notice the difference. Now, for those that would never have had it before and they have their first time, can you kind of attest to what makes them so drastically or non-drastically, different or similar to each other?
Yes. As we said in medical school, bodies don't read textbooks.
They do not.
Don't we wish they did? But bodies
do. Yes.
And because it would make our jobs easier, but they don't.
Right.
Is it possible to have atypical symptoms? Yes, it is. Is it possible to have both infections at the same time? Absolutely.
Hold on. It is?
But let's pretend, for conversation's sake, that our bodies read the textbooks and we only got one infection at a time, and we had classical symptoms only with nothing atypical. Humor me.
I'm going to do it. Okay.
Yeast infection will be burning, itching, and because the term itching isn't enough emphasis, to quote one of my favorite patients of all time, I feel like I need to stick a bottle brush in there and scratch it.
Why is that so relatable? I'm sorry.
Yeah. Gut wrenching. Because if you felt it, like if you know, you know.
If you know, you know, and if you don't, you don't.
I just said that, and you said, yes, a bottle brush is exactly the thing.
Yeah, I visualized it and everything. Yes.
Itching. Not just like, oh, I think it itches a little, but
No. Mm-mm.
tear jerking, itching. But no odor. Maybe a little yeasty odor. Maybe you might be like, oh, it smells a little bit like yeast, but not, I'm embarrassed to be in a public restroom because holy cow, odor. Okay. Itching, odorless. It can be uncomfortable. It can be painful because it's very red, raw, irritated. Yeast is disruptive.
Yeah.
There. BV, no itching, no discomfort, no pain, and odor. Bad odor, strong odor, fishy odor. A lot of patients say, I don't want to use the public restroom. I don't want to use the bathroom in my friend's house. I don't want to use the bathroom at my boyfriend's house because that smell is there when I'm gone.
Mm-hmm. It lingers. Yep.
Thin gray discharge, like just light, like not yellow, not red, but not clear, but a little color tinge. And those are the two classic definitions. And it's important to note that a UTI is different. No pain in the bladder, but you can have pain with urination with a yeast infection because it's so irritated and it's so, but it's not, the distinction that I tell patients is it's not necessarily that it hurts to go, but it hurts when it touches your skin.
It's like a tingly burning sensation, not like fire, but just like it makes you clench a little bit.
But if you could cover everything up and just go, it would be fine. We're getting real with our descriptions today. But I want people to know, right? These are the questions that people ask. Real. And I know the people that are listening are just going to be like, thank you for saying that.
Like literally, like I found my tribe, I found my people. And just to attest to the smell with BV, again, I'm going to bring up TikTok. This girl had made a viral video when she was working out and doing squats. She said she like leaned down and she smelt it. She's like, when you have BV and you have that smell, she couldn't even do the squat anymore because it's just so pungent. And I was like, for me, you just don't understand what the smell is like until you have it. Or if you've been around somebody that has it, and it just makes you so self-conscious, and nobody wants to experience that. And I think it also affects people's mental health at the same time because you become so subconscious about the smell, the feeling, and all of that, especially when it's chronic.
Can I get on a tangent? And we're already in a society where that's a problem. Right? Yep. Like we're already in a society that tries to minimize, talking about women's genitals and what a normal smell is and what a normal feel is and like what's normal, or as doctors, we say physiologic. We're already up against so much opposition when it comes to the natural state of our genitals that to have an infection and then like make it worse. My heart goes out to the people with vaginas who are dealing with BV because it's a really tough position to be in, but it is so common. I want to say universal, but I bet there's women out there or people with vaginas out there who would say, yeah, I've never had that before. But aside from those few people, this is universal.
Literally. And social media can be very damning, but I'm so glad for the people who have no problem sharing their experiences, because you would really be surprised that you're not alone. Like people think they have their own personal experiences, and then it's like you get around people or you get on social media and you're like, 10 million people are feeling the same thing I am. And it's like, yes, babe, you are not alone. Like, I promise you're not. So it does make me sad with how society just constantly has all these opinions and say-sos when it comes to women's body and what's considered normal and what's not. And especially when the opposite sex or even the same sex has no knowledge about it, it just makes you feel even worse about yourself. So I'm so glad that we're doing this and we're talking about it just to normalize it to an extent. Yeah, it's just sad. It really is. And even when it comes down to, getting treatment for it, so many people are running into the issue just like with UTIs and yeast infections. It's chronic. And I understand like first time treatment, antibiotics definitely need to be included in that. But if it's coming back, same thing with UTI, like what's the next step? Is there a specialist for that? Or is there a way to fully you know, get rid of this?
We see a lot of chronic BV. We really do. And the reason
Mm-hmm.
why is because BV can form on the inside walls of the vagina, can
Mm-hmm.
cause a biofilm, which basically just means there's a lot of bacteria lining the walls and they're kind
Mm-hmm.
of like a little fortress. And
Mm-hmm.
it's just a tough nut to crack. And the gynecologist is the specialist who is an
Got it.
expert in figuring out, is this acute BV, meaning short term?
Mm-hmm.
Is it long term
Mm-hmm.
BV? Is it recurrent BV? And what can be best done about it to not
Mm-hmm.
only get rid of your symptoms today, but prevent it from coming back once a quarter, like most of our patients
Mm-hmm.
have.
Oh man. And so, I know we constantly hear about pH balance. Like, how does someone go about regulating that? Because I know people hear about pH, but they also don't know what it stands for and they really don't know what it does. So, are you able to kind of expound on that a little bit?
Yes. So, what I would say to all of the people out there who are thinking about it is pH is the acid
Okay.
level in your vagina. And it's really a
Mm-hmm.
chicken and egg scenario. What came first? Did your pH get altered and that's why you got BV? Or did you get
Mm-hmm.
BV and it altered your pH? And the answer is, I don't think that we will know.
Yeah.
However, vaginas are generally designed to be self cleaning machines.
Mm-hmm.
Water and a soft washcloth is all you
Mm-hmm.
need, or nothing, just water.
Nothing. Yeah.
The washes, the douches, the soaps, the things that
Mm-hmm.
even products that say they're designed to go into the vagina can cause BV. I see it all the time. They're lying to you. You don't need to put that stuff in, on, around. Now, externally on the
Mm-hmm.
skin, which is the mons and the external labia majora, go for it.
Yeah.
Whatever you want to put out there, go for it. But inside, she will take care of herself.
Yes.
And we
So,
don't have to worry about. Now, some people, boric acid suppositories may be a good option for you.
okay. I'm
Talk
glad
to
you
your
brought that
doctor
up.
before you
Mm-hmm.
decide that, right?
Mm-hmm.
Because
Mm-hmm.
those are decisions that you should make autonomously with your healthcare provider rather
Mm-hmm.
than going in and trying to change the conditions in your vagina, because that's how people get chronic infections. And so
Mm-hmm.
usually what I tell people is, let's fix what we've got going on here.
Mm-hmm.
Let's leave her alone and let her take care of herself because she
And
knows
do
how to
her
do
thing.
that.
Yes. So quick thing with that, we have, and I don't want to like blast company names, but the brands that we see in that specific aisle that we shop in, and it'll always say dermatologist tested. So, in your mind, you're like, oh, well, if a dermatologist said it's cool, I'm like, well, can't they be paid to just put those, those marks on there? And I wish we could put like a diagram because nobody knows what the vagina is. Like people will say, oh, I know what the vagina is. And then you're like, okay, point at it on this diagram. And then they're pointing at something that is like not even it. So imagine that we have a whole diagram here. What we're talking about are those two exterior lips, and then you have the two smaller ones. I know you're going to give the technical terms, the medical terms for those. So when you're talking about cleaning, you're talking about that exterior area where the pubic hair grows, not the area that is more on the fleshy side where there's no hair at all for when it comes to cleansing that area. I just want to have you break that down so people aren't still thinking, oh, well, she said I could still put stuff down there. No, we're not talking about like inside or on that skin or any of that. We're talking about a certain area of your actual, vaginal area. So if you could just kind of like help paint a picture of what we're talking about, that'd be perfect.
First of all, I think you've done an excellent idea, and or you've done an excellent job painting, giving the idea, and you don't need my words at all. But since you've asked me, I will give you the
Please.
words with the caveat
Mm-hmm.
of you're great and you don't need me. But where the pubic hair grows is
Mm-hmm.
the absolute right way to say it, because
Mm-hmm.
that's the same type of skin as we have everywhere else on your scalp,
Right.
on your arms, on your legs, same type of skin. And you can clean it in the same way.
Mm-hmm.
But
Now,
you're
yeah, I was gonna
talking
say, go
about the
ahead.
mons. We call that the
Mm-hmm.
mons. And
Mm-hmm.
or the labia majora, which is the
Jorah. Mm-hmm.
larger kind of lips on the outside. Pubic hair grows there. It is the same type of skin on the rest of our body.
Mm-hmm.
But peeling back the layers of the onion or the orchid, let's say the
Mm-hmm.
orchid, peeling back the layers of the orchid, you have the labia minora, the clitoris is in there. The
Mm-hmm.
urethra is in there. The introitus and the vestibule are the
Mm-hmm.
fancy $5 words for all the things that are inside. And
Mm-hmm.
while there may be some like discharge or material that you can gently clean out of there with your hand or a wash rag,
Mm-hmm.
keep that stuff on the aisles that are I assure you that the dermatologist is most, I mean, I've never asked one, but I might after this.
Right. Yeah.
I assure you they're not spreading open the labia majora, rubbing that stuff on the inside to see what happens and testing
They're
it.
not. Mm-hmm.
I don't think they are.
I personally don't think they are either. And just one quick, like another segue. When it comes to pubic hair, having hair down there and not, can that also be another cause to getting BV or yeast infections? Because to my knowledge, hair is a form of a protector, whether it's in your nose, ears, whatever. So in my mind, it's down there to protect your body from, getting certain things attacking onto it. So if you're more prone to shaving and waxing down there, are you also more prone to getting infections because you don't have pubic hair?
There have been a few studies out there specifically around HIV and things like that,
Mm-hmm.
and they talk
Mm-hmm.
about transmission. However, that's not what we're talking about here. And no, to
Mm-hmm.
my knowledge, I've never seen a study, and there might be. And if you're listening to this and you're like, I've seen a study, send it in. I'd
Yeah.
love to see it. Where hair or lack thereof increases your
Mm-hmm.
likelihood or decreases your likelihood of having what I would consider to be routine vaginal infections such as yeast, BV, or UTI. Would love to
Mm-hmm.
see that information,
Yeah.
but I don't know
No,
about it.
Yeah, and I haven't heard much about it, but I've seen, just in the comment section where women who are pro pubic hair versus not, they're like, well, this is why you guys get infections because you don't have any down there. So it was definitely that form of disconnect there that I was very interested in. And then also I followed this one dermatologist who says that she uses not is it might be CeraVe or Cetaphil, one of the two. They're in the same family. She actually uses it down there to cleanse herself, and I'm like, that's very interesting. Like I don't see it being a bad thing. She uses just like the full on like gentle cleanser, but it was very surprising to know that she uses a face wash down there. Do you have any thoughts on that?
It's the same type of skin. It really
Mm-hmm.
is. But what we love about CeraVe or Cetaphil,
Mm-hmm.
water-based, dye-free, odor-free,
Mm-hmm.
irritant-free. If it's safe enough for your face, it is safe enough for your labia or your mons.
Okay.
100%. They're both very delicate areas, and I would
Mm-hmm.
trust anything. I would trust something like that for the face down there. I definitely would. But I agree with
Awesome.
you. If you don't have a medical degree, you should really consider giving medical advice, especially on social media, and telling
Yep.
things, well, you have pubic hair, so that's why you get infections. Be very careful about
Mm-hmm.
practicing medicine without a license. I would
It's
caution
risky
against
business.
this.
Yeah, because I know even with Wisp, they have their balancing wash, and I've used it and I love it personally, just because again, like you were saying, there's no fragrance, no dye. It's super gentle, and the texture of it definitely reminds me of which one? I would say it kind of reminds me of Cetaphil, just like the gel texture of it, and it's great. And for me, just like you said, I don't water is my go-to, even when I'm cleaning my hood or anything like that, and near the clit, that's just water going down there. Anywhere else, we can just use something super gentle. And I think when it comes down to people being self-conscious about their smells and different things like that, they want to use perfumes. And I'm like, your body has her own scent. Like, so you mixing your personal scent with lavender, it's just going to make a concoction that you didn't sign up for. So I really want us to break away with having to constantly use something that's fragranced in an area that is not requiring it at all. Um, and so, when it comes to BVs constantly coming back, is there really a way to stop it? Because, if treatment isn't working and, people want to explore other ways, to look into stopping it all. Because I know STIs like chlamydia, gonorrhea, trichomoniasis, those all can cause like unusual discharge. So is there really a way to stop it, or is it just something that you're just going to have to deal with over time?
No, I would never, ever, ever say you just have to deal with it, because
Mm-hmm.
this is something that it's just an overgrowth. It's an overgrowth of bacteria. It's,
Mm-hmm.
like going to the forest and cutting down some vegetation, right? Like we can do this,
Mm-hmm.
but it's really important to, first of all, I will tell you, we're talking
Yeah.
about BV, but lately
Mm-hmm.
there's been a surgence of AV, which is anaerobic vaginalis, and it's a different type, vaginitis,
Do tell.
vaginalis, depends on who you ask. You
Right.
or vaginosis, you can, doesn't matter
Mm-hmm.
what word you use, it all means the same thing. Different type
Mm-hmm.
of bacteria causing an overgrowth, similar symptoms. So it's
Mm-hmm.
important that you know what bacteria you're dealing with, which your gynecologist can help you with,
Mm-hmm.
picking the right type of regimen, and then deciding if it needs to be short term or long term. There are some people with vaginas who have to do 6 to 12 months of
Right.
like vaginal metronidazole gel, or 14
Mm-hmm.
days of oral antibiotic, and then 6 months of staggered out therapy to break that biofilm that we talked
Mm-hmm.
about earlier,
Yeah.
get rid of that coating of the
Mm-hmm. Like
vaginal
that
walls,
wall. Mm-hmm.
break it down, because the what you talked about earlier with, I think we talked about it in the last episode with UTI,
Yeah.
suppressing that actually can happen in
Mm-hmm.
B, B. You're just decreasing it just enough that you don't have symptoms, but you don't get rid of it
Right.
all the way, and then it
Mm-hmm.
comes right back. So no, I don't think that it's that, oh, you just have to deal with it forever, but I do think you need to work with somebody who's committed to finding the right treatment for you and creating a
Mm-hmm.
treatment plan for you so that your body and your vagina can have long-term success.
Right. Awesome. And I'm just really appreciative of Wisp that you can still get the type of antibiotics that you need through them. And, when it comes to those at home self care remedies, like, can you just give your definitive answer on how you feel about putting anything inside of your vagina to cure, like yogurt tampons, apple cider vinegar tampons, boric acid tampons, like people pouring boric acid powder like on the tampons? Like, where do you stand on actually inserting these type of things inside of you to cure, whether it's BV, yeast infections, whatever it is?
There are medical grade products that
Mm-hmm.
are safe and can be
Mm-hmm.
recommended. When I think
Okay.
about suppositories, you're talking about suppositories. What are the
Mm-hmm.
types of suppositories that are safe? If they're
Right.
compounded by a pharmacy, so boric acid, even
Mm-hmm.
like topical antifungals,
Mm-hmm.
clotrimazole, miconazole, those are over the counter. Uh,
Right.
or if you have BV, it can be clindamycin suppository, metronidazole
Mm-hmm.
suppository. Those are safe. Those are designed to treat the infections and handle the situation that you have
Mm-hmm.
going on at any given time. But household items, kitchen
Yes.
items, they're not sanitary.
Mm-hmm.
Probiotics are great. You can take them. Boric
Right.
acid can be appropriate in some people. I do not
Mm-hmm.
recommend pouring boric acid on a tampon and sticking it in there, because it is an acid. Your
Mm-hmm.
vagina is a mucous membrane, which is very sensitive. And I would
Mm-hmm.
recommend using an actually, a manufactured compounded suppository rather than some powder that you
Right.
stick up there yourself, because you don't want to hurt her. You want to help her. So
Mm-hmm.
I would say anything household, don't do it. You can't guarantee the cleanliness, the safety, the quality, whether there's bacteria already in it or the
Mm-hmm.
effectiveness. But if it's medical,
Right.
it's compounded, and it's intended for that purpose, do so in conjunction with your doctor or nurse practitioner, please.
Please and thank you, please.
You,
Because the amount of
yes.
times I've seen, well, I just get Greek yogurt, and I just stop listening after that because I'm just like, babe, I just and they are like stands to the Greek yogurt to where it's like it's worked. And I'm like, did it just heal your symptoms or did it actually work? Because if you're continuously doing it, I don't think that it's, healing. I think it's just, subsiding whatever you're feeling. It could be placebo effect. I don't know at this point. But and I don't want to take away from anybody's experience and what they've used to, take care of themselves. But at the end of the day, I just feel like certain things just aren't meant to go in that area. And just like you said, suppositories, which are made by a pharmacist and prescribed, those things are fine versus you just going to the grocery store or whatever's in your fridge and putting it up there. So now it is time to do some fact versus fiction. Are you ready?
I'm ready.
So, okay. Douching or washing can prevent BV. I'm trying not to laugh because the first word just already threw me, but go ahead.
I'm not going to try not to laugh. I'm just going to go ahead and laugh.
No. Go ahead.
No.
No. I can even say that. I'm like, no.
Douche. Don't do it. Don't do it. Don't do it. Do not douche. Do not douche. Can I say it again? How many more times can I say do not douche? It's not going to help you. It serves no purpose. It's only going to make things worse. And she doesn't need it. I've actually seen tons and tons and tons of patients that have caused their own BV by douching, not helped or resolved. So no. Washing.
Can you just explain what it is real quick, what douching is, just for those who don't know?
A douche is a product. It's usually a balloon or a bottle type of product that you put some sort of substance inside and squirt it into the vaginal canal, the actual opening where babies come out of, in and out, in an attempt to clean it.
Oh man,
serves no purpose.
Sounds wrong. Like
she will clean herself. She doesn't need you to do it for her
at all. Okay, no. Next round. I can only get BV if I'm sexually active.
Wrong. If you own a vagina, you can get BV, whether you are having sexual activity or not.
Thank you. Okay. Because there's like this huge misconception, like when people get it, especially if they're younger and their parents find out and it's like, what have you been doing? And it's like, nothing. Like it can just, like you said earlier, it can just come on its own. Like whether, your pH is off, whether you ate something, whatever the case is, like it can just come on its own. So I'm glad that people do know that it doesn't require you to deal with a partner to experience this. And then the next one, BV is sexually transmitted.
No. Negative. Although
I was going to say, but what's the but?
There are rare instances in which sexually transmitted by who, right? If you have a female partner, of course, yes, you can, right? Have I seen instances where there have been male partners where perhaps the biofilm is being disruptive or transmitted back and forth? Yes. Is it considered an STD? No. Is it considered an STI? No. If you get diagnosed with it, do you need to inform all of your partners? No, you don't. However, there can certainly be instances where there's co-infection, reinfection, and it might become necessary or relevant to treat the male partner or the female partner, but we do not consider it to be an STI or an STD at all.
Okay. I have a quick question though. If someone does have BV and their partner gives them oral sex, what happens in that? I don't know if there would be a transmission or not, but what happens in that if, they do have it and their partner gives them oral sex? Like, is there any form of consequence to that or,
No, there's not.
No? Okay.
It may not taste or smell as good.
Pleasant,
and I might encourage, as uncomfortable as it may be, I might encourage partners to be open and honest in that communication, because that might be the only way that a person with a vagina could find out that they potentially have an infection. So lovingly, kindly, gently saying things seem a little off.
Yeah.
Might be the first way that someone could know that there's even something going on.
Okay. All right. Last one. Eating acidic foods can prevent BV.
No. Wrong. I mean, think about it. I'm going to drink orange juice.
Right.
Let's think about the GI tract and the reproductive tract.
Mm-hmm.
Totally different tracks, right?
Right. Right.
Mouth, esophagus, stomach. In the stomach, food is broken down. In the small intestine, food is absorbed. In the large intestine, food is excreted.
Mm-hmm.
The acid level of my blood doesn't change if I eat acidic food. It's very important that your body and your kidneys maintain a normal acid level of your blood because that's how you don't die.
Right.
And there's no mechanism by which the acid in the GI tract can physically get into the reproductive tract, which is vagina, uterus, fallopian
Mm-hmm.
tubes, ovaries. There's no connection and
There's no
no
way.
communication between the GI
Mm-hmm.
tract and the reproductive tract. And yeah,
Mm-hmm.
they do share the same blood generally, but the
Right.
blood is not made more acidic if you eat acidic foods. It's very important that our body maintain a very normal acid level in the blood. So
Mm-hmm. Okay.
false.
Darn. Okay. Because I was just like, since we're talking about acidity and how it can, nope. You're like, nope, false.
No,
Okay.
no
I love
relation.
doing fact. I love doing fact versus fiction with you because I think I know what I know, and it's like, damn, Symone, you still don't know much of anything, honey bun. So,
Yeah.
so glad to have you. All right,
False.
now we're gonna dive into. You're like, no, Symone, wrong. So we're gonna dive into patient's story time. This one kind of broke my heart a little bit after reading it, just because I could tell that there was a lot of a lack of accessibility to information and just knowledge overall. But I'm just going to go through it real quick, and then we can just chat about it afterwards. So after nearly 5 years of itching and having this weird smell and gray matter come from my vagina, I've self-diagnosed myself with bacterial vaginosis. It is beyond embarrassing to even confess that something's wrong with things below, but I'm freaking out. I Google this from time to time over the course of 2 years, now after I figured out that this may not be normal. So here's where I start freaking out. I left this untreated for nearly 5 years, and I read that left untreated, it may cause infertility to even cancer. I feel like an idiot and less of a young woman for not being informed on what's normal and what's not. I mean, no one taught me what was normal or what to expect of your vaginal health. Not school or my mom or my grandmother's or aunt. No one. I know I'm supposed to clean myself daily, and I did, but clearly I went wrong somewhere. I guess they all expected for things to go smooth sailing, but it's not. By luck, I didn't have a noticeable stench after so long, but just thinking back on things, I can't believe my naivety. Okay, sorry. This just sucks, man. Anyways, I secretly purchased a 7-day vaginal antifungal cream and a case of anti-itch cream. I need to see a doctor so that I can at least check on things, but I'm awfully embarrassed to bring this up to my mom. Like I said, since no woman in my family had ever told me how to take care of things with my vagina, it'd be embarrassing to pop out of the blue and confess to having something wrong down there. I asked when I should start seeing a gyno, and my mom said when I start becoming sexually active. Well, thank God I've never done anything with a guy, but I think now would be the perfect time to drop in for a visit. What should I do now? Do I tell my mom and schedule an appointment, or do I just continue to secretly take care of things? Okay, and granted, this is not my first time reading it, but it made me sad because it just literally, I don't know how old she is, but I was roughly around the same, I'm gonna say the same age as her, and I feel like I told you this story before, but yeah, I experienced the same thing. And no, there's like no shade or shame on my mom or anything like that. I'm one of 4, and I'm like her third daughter. But same experience of, I don't know what I'm doing. I don't know what I'm experiencing. I'm thinking it's a yeast infection, and it's not. It's something completely worse than that. And I'm sure it got worse because I allowed it to be so prolonged untreated. And so when I did finally talk to her about it, and it wasn't she was embarrassed, she just didn't know how to react or respond to it. So, we went to the doctor. The doctor is literally looking her in the face and telling her what's happening. And my mom is just looking at me like she wants to cry. And I'm looking at her like I want to cry because I'm embarrassed. And, she doesn't know what to do. And so it's attesting to her, she went 5 years of experiencing this and not feeling comfortable enough to talk to her mom or grandmother or whoever, in her life. And on top of that, not being taught in school, like at bare minimum, health class should be talking about this, but it doesn't. Even when I took my health class, the only thing that I was taught about was my period. And I still fumbled the ball when I first got mine. So I'm rambling at this point. But yeah, if you want to kind of like dive into, her main questions are, what should she do? Does she tell her mom and schedule an appointment, or just continue to secretly take care of things? And I know we both are on the same page of what she should do, but I want to hear your thoughts.
First, I would say, honey, I'm sorry that your mother and the women in your life dropped the ball, but that's what we're here for.
Mm-hmm.
If you had a problem with your teeth, you would go to the dentist without question. If
Right.
you had a problem with your eyes, you would go to the eye doctor without question. And I don't know your family. I don't know your community. I don't know where you're from. And I don't know how you were raised. The
Mm-hmm.
vagina is an organ, it is a body part. And we're not going to place judgment on things going wrong with that body part or being
Right.
atypical with that body part any more than we will. We don't judge you if you have a tooth problem. We don't judge you if you have an eye problem. We don't judge you if you have a skin problem or an ear problem or a
Mm-hmm.
foot problem. And we're not going to judge you if you have a vagina problem. But the fact
Mm-hmm.
of the matter is that the only person in the world who could help you is a gynecologist. And
Right.
there is no age where it is the right person to go see. There is
Mm-hmm.
no time of life. You have a
Mm-hmm.
vagina, which means you have a right and you are entitled and you have
Mm-hmm.
access to the doctors whose
Yep.
specialty is that part of the body. And it's not good or bad, it just is what it is. Things go wrong with different parts of our body. That's part of being alive. We have hair problems, we have nail problems,
Mm-hmm.
we have vagina problems. It's just a part of the body. And there is no
Mm-hmm.
judgment or attribution placed on that. I,
Right.
from what you said, I don't think that an antifungal is the right answer. This doesn't sound like a
Yeah.
fungus problem, but I don't
Mm-mm.
have the ability to talk to you. I'm only listening to
Right.
your story. I think an antifungal would make it worse. And you don't have to tell your mom. You don't have to ask your
Mm-hmm.
mom. In most states, you can be a minor. And if you need gynecology help, you can go see a gynecologist. But I do
Mm-hmm.
think that just as you would with any other part of your body, it is so important that you go see the expert whose job
Right.
in life it is to help you. Please don't let it go on not even a day longer. Go see somebody
Mm-hmm.
about it and invest in yourself and get that care that you need.
Wow. Well, Dr. Purdy, that like top tier response. And one last thing before we go, I just thank you so much for debunking. You don't need to wait to go see a gynecologist until you're sexually active. Like, no, I got my period. I was 9. We're going to the we're going to the gynecologist. So I appreciate you for saying that, because it sounds like she's probably at a certain age where she should have been seen one prior. But I do hope, everything that you said, that it reaches her and she is able to get the help that she needs, and she does end up getting a comfortable relationship with the women in her family to be able to talk about these things, or find someone in her life to be able to talk about these things. But again, Dr. Purdy, thank you so much for your time, for chatting it up with me and just ranting with me. I can't wait to see what we get to talk about on our next episode. And again, guys, be love, be light. We'll see you next time.
Thank you, Symone. Bye.